In today's practical session, we are going to start next experiment number 23, to observe and study the effect of diphenhydramine in experimentally induced asthma in guinea pig by using CD of MSBTE. Diphenhydramine, it is an antihistaminic agent, and antihistaminic agents are the pharmacological agent. They inhibit or prevent the physiological effect or response of histamine. Thus, they are known as antihistaminic agents. So, diphenhydramine, it is an antihistamine. So, let's see theory or proposition first, in which histamine, it is an potent biogenic or tissue amine which is present in various biological fluids, platelets, leukocytes, and basophils, and also in mast cells. Then antihistamines, their definition, the drug which reverses action of histamine by competitive antagonism is known as antihistamines, or these are the pharmacological agents. They inhibit the triple response of histamine, or they inhibit effects of histamine is known as antihistaminic agent. All this part covered in previous lecture in theory. So examples of antihistamine are diphenhydramine, chlorpheniramine maleate. Then next point, preposition third. Histamine act on H1, H2 and H3 receptor. Sound is audible to all?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So histamine, it acts on H1, H2 and H3 receptor, in which location of this receptor, H1 receptor in bronchi, H2 receptor, they are located in GIT, that is parietal cells of gastric intestinal tract. Then H3, it is located in CNS, brain or thalamus. Then their effects were already studied in theoretical part in autocoils chapter. The next one, preposition 4, anaphylactic shock. The shock due to antigen antibody reaction and includes bronchospasm, asphyxia, fall in blood pressure and death. Means also histamine produces pain or in some allergic condition. These agents are used. So the shock, it occurs due to there is reaction in between the antigen and antibody, or allergy is produced due to there is reaction in between antigen and antibody. Then next point, so also during this anaphylactic shock, bronchospasm is also occur, fall in BP, and at the end, death is occur. Then next, formation of histamine, that is synthesis of histamine, in which histamine it is synthesized from histidine in presence of enzyme histidine decarboxylase. After that, preposition 6, histamine aerosols. It is a suspension of drug dispersed in fine spray or mist form. This is diagram of histamine aerosol chamber, in which two compartments or partition in this histamine aerosol chamber. Screen is visible to all?
Yes, ma'am. Yes, ma'am.
Okay, category of diphenhydramine. Category of diphenhydramine. Sound is audible to all?
Antihistamine.
So this antihistaminic agent is used to produce asthma in guinea pig. This experiment we have to study, in which this histamine aerosol chamber is used. means antihistaminic agent. Diphenhydramine, how produces asthma in the guinea pig. We have to study by using CD of MSBTE, in which firstly this anaphylactic shock, antigen and antibody reaction is occur. This is known as allergy, and this shock due to antigen and antibody reaction, it includes bronchospasm. Bronchospasm means spasm of bronchial muscle contraction. Asphyxia, in which there is deprived or lower level of oxygen and which is leads to unconsciousness or suffocation or death. Then fall in BP and death is occur. So all these observed in the experiment. So let's see the procedure. What is biological name of guinea pig?
Cavia porcellus.
Effect of diphenhydramine in experimentally produced asthma in guinea pigs.
The name of this experiment is Effect of Diphenhydramine in experimentally produced asthma in guinea pigs. The objectives of this experiment are to study antagonism of constrictor action of histamine and like substances, to understand pathophysiology of asthma, to understand that asthma is an inflammatory illness as a result of bronchial hypersensitivity known as bronchospasm, to understand that allergens are responsible for asthmatic inflammation by releasing histamine and like substances in the body, to know histamine and like substances are accountable for all hypersensitivity reactions involved, to understand histamine stimulation of smooth muscles of bronchi results in bronchoconstriction causing difficulty in breathing.
Then requirements for this experiment. Animal, rabbit is used up. Then drug, histamine, 20 mg per ml, diphenhydramine as antihistaminic agent, diphenhydramine, HCl, 2.5 mg per kg. Then instrument or equipment is histamine aerosol chamber and method used protection against histamine aerosol chambers. Which animal is used up?
Rabbit.
Rabbit.
A person overreactive to a substance tolerated by most other is said to be hypersensitive, that is, allergic. Substances which induce allergic reactions are allergens. Common allergens are milk, antibiotics like penicillin, vaccines like typhoid vaccine, snake venom, pollens, dust, molds, etc.
Means some antibiotic or some common allergens, they produces anaphylactic reactions, that is allergic reaction. A person overreactive to substance tolerated by most other is said to be hypersensitive, that is allergy. Over tolerate or overreactive substance of by any individual which leads to allergy. The substances which induces allergic reaction, these substances are known as allergens. Then common allergens, their examples milk, antibiotics like penicillin, vaccines like typhoid vaccines, then snake venom, pollens, dust and molds. They are responsible to cause the allergic reactions or anaphylactic shock.
The most common reaction is anaphylactic reaction and occurs within few minutes of exposure to allergen. In this reaction, IgE antibody sensitized mast cells and basophils release histamine, prostaglandins, and kinins. These mediators cause vasodilation, increased capillary permeability, increased smooth muscle contraction of lungs, and increased mucus secretion. As a result, there is difficulty in breathing, runny nose, wheezing, along with shock due to vasodilation. Such condition can be treated with adrenaline injection and some antihistamines.
The most common reaction is anaphylactic reaction. It is occur due to when exposure to few minutes to the allergen substances. Means anaphylactic reaction is occur when exposure for the 2 minutes to the allergen substances. Then in this reaction, IgE antibody. It is type of antibody which sensitizes mast cells and basophils. It is type of WBC which releases histamine, prostaglandin, and kinins. These are the autocytes. When IgE antibody sensitizes the mast cells and basophils, they release substances or autocytes like histamine, prostaglandins, and kinins. This mediator means what is action of these released substances or autocytes is given. These mediators causes vasodilation, increased capillary permeability, increased smooth muscle contraction of lungs, and increased mucus secretion. So because of this increasing effect or these pharmacological actions produced by these released substances or autocytes, as a result, there is difficulty in breathing, runny nose, wheezing, and along with the shock due to vasodilation is occur. Such condition can be treated with adrenaline injections and some antihistamines. Means the effect histamine produce करतो, that effect is treated by antihistaminic agent. So these effects are given here in which histamine, autocars, histamine, prostaglandin, kinins, they causes vasodilation, increase in smooth muscle contraction of lung, increased capillary permeability, then increased mucus secretion. And this results difficulty in breathing, runny nose, wheezing, along with the shock due to vasodilation effect. Such condition can be treated by given antihistaminic agents such as diphenhydramine, and also they are treated with adrenaline injection. This is theory behind the experiment.
Although the guinea pig has been favored for screening antihistamine agents because of its sensitivity to histamine, the rabbit may serve when a second species is desired. With the help of histamine aerosol chamber, one can test effect of histamine and antihistamines like diphenhydramine on rabbit. Antihistamine antagonizes effect of histamine, and improvements in signs and symptoms of asthma can be observed.
So guinea pig has been favored for screening of antihistaminic agent because this guinea pig animal, it is sensitive to histamine. So second choice animal, rabbit, it is used for this experiment. With the help of this histamine aerosol chamber, one can test effect of histamine and antihistaminic like diphenhydramine on the rabbit. Antihistaminic antagonize effect of histamine and improvement in the signs and symptoms of the asthma can be observed. So firstly, two animals in this two compartment, two animals are placed the second species or second choice for this experiment animal used are rabbit. Guinea pigs, they are sensitive to histamine, that's why they are not used up. With the help of this chamber, check out the activity of diphenhydramine, how it induces asthma in the rabbit. Then let's see procedure. Screen is visible to all.
Yes, ma'am.
To
Yes.
study the effect of diphenhydramine in experimentally produced asthma, always select 2 healthy rabbits of either sex. Experimentally, asthma is produced by using histamine aerosol apparatus. It consists of 2 chambers separated by perforated partition. It is provided with arrangement to spray histamine comprising of a pump, a pressure gauge and container for histamine, which is in turn connected to pump. Inject diphenhydramine hydrochloride in a dose 2.5 mg per kg into ear vein of test rabbit. Control rabbit receives equal volume of normal saline. After 1 hour, place both rabbits in separate compartments and label it as test and control respectively. Observe normal behavior of both the rabbits. Now, histamine aerosol is introduced with the help of pump at 180 mm of mercury. You will observe the control rabbit, which has received normal saline, shows difficulty in breathing characterized by rapid abdominal movements, increased motor activity, state of anxiety followed by head drop. At the same time, notice the behavior of the test rabbit, which has received diphenhydramine hydrochloride. It shows normal behavior. Therefore, we can say diphenhydramine, which is histamine H1 receptor antagonist, has actually protected the rabbit from histamine induced difficulty in breathing. Study the effect of diphenhydramine in experimentally produced asthma. Always select 2 healthy rabbits of either sex. Experimentally, asthma is produced by using histamine aerosol apparatus. It consists of 2 chambers separated by perforated partition. It is provided with arrangement to spray histamine.
It is histamine aerosol chamber, which is used to check out the activity of this rabbit or animal. When diphenhydramine is given, then it produces asthma or not. So in which 2 separate compartments, they are separated by perforated glass partition. This apparatus is available in laboratory.
Comprising of a pump, a pressure gauge and container for histamine, which is in turn connected to pump. Inject diphenhydramine hydrochloride in a dose 2.5 mg per kg into ear vein of test rabbit. Control rabbit.
Which route is used to inject diphenhydramine?
Air vein.
Air vein.
Receives equal volume of test rabbit. Control rabbit receives equal volume of normal saline. After 1 hour, place both rabbits in separate compartments and label it as test and control respectively. Observe normal behavior of both the rabbits. Now, Histamine aerosol is introduced with the help of pump at 180 mm of mercury. You will observe the control rabbit, which has received normal saline, shows difficulty in breathing characterized by rapid abdominal movements, increased
Okay, difference दिसतोय दोन्ही रॅबिट मध्ये कंट्रोल अँड टेस्ट.
Yes, ma'am.
प्रोड्युसर
Yes, ma'am.
ब्रीदिंग मध्ये डिफिकल्टी and also remaining effects such as bronchospasm, asphyxia, then suffocation. It is produced by histamine.
motor activity, state of anxiety followed by head drop. At the same time, notice the behavior. Notice the behavior of the test rabbit, which has received diphenhydramine hydrochloride. It shows normal behavior. Therefore, we can say diphenhydramine, which is histamine H1 receptor antagonist, has actually protected the rabbit from histamine induced difficulty in breathing.
So here we can say diphenhydramine produces antihistaminic activity and to protect this rabbit from histamine induced histamine produced difficulty in breathing. ज्या ॲनिमलला रॅबिटला डायफिनहायड्रामाइन इंजेक्ट केलाय त्याच्यामध्ये डिफिकल्टी इन ब्रीदिंग ऑब्झर्व होते
The
का?
antagonist has actually protected the rabbit. Diphenhydramine
डायफिनहायड्रामाइन इंजेक्ट केलेल्या टेस्ट ॲनिमल मध्ये डिफिकल्टी इन ब्रीदिंग किंवा फॉल इन हेड ड्रॉप इन हेड ऑब्झर्व होते का?
No, ma'am.
No, ma'am.
Yes or no?
No, ma'am.
Means histamine produces factor in animal which produces difficulty in breathing. So we have to write head drop. डायफिनहायड्रामाइन दिलेल्या रॅबिट मध्ये हेड ड्रॉप झाले का?
No.
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 Okay, so we have to write this observation in observation table. In which animal drug treatment during experiment observations in the response as per your manual. So observation table in which firstly saline, in which dose mg per kg 2.5, then bronchospasm, yes, convulsions, yes, head drop, yes, when diphenhydramine is given. Diphenhydramine घेतलेल्या animal मध्ये convulsions होते का? Head drop, bronchospasm. So you have to
No.
write no. Bronchospasm no. As such normal movement होती त्या animalची. ज्या animal rabbitला आपण diphenhydramine inject केलेला that animal. In normal cases saline solution दिलेला animalला that is control animal in which bronchospasm is occur, head drop is occur, convulsions also occur. So here you have to write yes and yes. In diphenhydramine response is no. Bronchospasm, convulsion, and head drop, no. Then their dose 2.5 mg per kg. Adrenaline inject केलेला का आपण?
No, ma'am.
So this is about observation table. Then conclusion. Histamine causes Bronchoconstriction or bronchodilation?
Bronchoconstriction.
Bronchoconstriction. Histamine causes bronchoconstriction and diphenhydramine produces histaminic or antihistaminic?
Antihistaminic.
Antihistaminic effect. So this is about today's experiment. To study the effect of diphenhydramine experimentally induced asthma.
What you have learnt. Administration of histamine is associated with anaphylactic bronchospasm and is not recovered by diphenhydramine alone. Asthmatic airway narrowing is due to inflammation. Allergens are responsible for release of histamine. Antagonism of constrictor action of histamine on respiratory smooth muscle can be studied by producing asthma in laboratory animals. Speedy recovery from shock and protection to animal is done away with administration of adrenaline with diphenhydramine.
Okay, so we learned from this experiment allergens. These are the pollens, mouse, or any other substances. They produces allergy, that is antigen antibody reaction. And after that, this allergen they are responsible to release the local hormones such as histamine, that is classification of protocol, histamine, prostaglandin, kinins, bradykinin, and this release of histamine they produces effect on the human body or animals. Then these effects are effects such as bronchospasm, anaphylactic shock, suffocation, difficulty in breathing. So this effect recovered by giving antihistaminic agents such as diphenhydramine. Here we complete experiment number 23.